Welcome, everyone. Thank you for joining us for today's CITI program webinar. Today's topic is Emergency Preparedness and Response, Collaborative Approaches to Ensure Sustainability of Research Oversight. Dr. Nichelle Cobb is the Senior Advisor for Strategic Initiatives for the Association for the Accreditation of Human Research Protection Programs. Prior to joining AHRP, she was the Director of the Health Sciences IRBs for 16 years at the University of Wisconsin-Madison and has worked with IRBs for 20-plus years. Nichelle has been involved in single IRB work for 10-plus years and is a Senior Advisor and Ambassador for SMART IRB. She has co-led working groups to harmonize IRB and HRPP practices. Nichelle contributed to the IRB Management and Function 3rd edition, authored academic articles on single IRB and informed consent, and developed and taught primer courses. Dr. Robert Hood is AHRP's Director of Accreditation and Global Outreach. In this role, Dr. Hood engages with stakeholders to ensure AHRP accreditation standards are consistent with evolving research ethics guidelines, laws, and professional practice standards. Robert has a background in applied ethics and has worked in academia, government, and not-for-profit organizations. He has served as an IRB chair and managed the HRPP at the Florida Department of Health, the first public health agency to obtain accreditation. He has implemented public health ethics programs and chaired a public health ethics advisory committee at the Centers for Disease Control and Prevention. Prior to this, he was Associate Professor of Philosophy with tenure at Middle Tennessee State University.
So what we want to talk about today are AHRP's suggestions about emergency preparedness. And so here are some objectives. We want to talk about why having an emergency preparedness plan is critical to the protection of research participants. We want to talk about the factors to consider as you develop your emergency preparedness plan, and to talk about who you might want to engage or involve in this development process, and then understanding the importance of evaluating what you do as well. One of the things I think we learned from Hurricane Katrina is the importance of the location of paper records. We saw some organizations have some records destroyed due to flooding, and then other records were impacted by mold and mildew and things like that. So you may want to be thinking about working with researchers to contemplate, where are they currently storing records? If they're in paper, what are their chances of them being destroyed by different types of events? We mentioned flooding, but it could also be a different type of emergency. It could be fire-related hazards. If your records are electronic and you're dealing with extended power loss, and your electronic mental system is local to your organization, that might present different challenges than if you have electronic records hosted by people outside your local geographic area. And that's something we mentioned there is about decentralizing records.
I'd like to highlight CITI program's Disaster Planning and Response series of courses. This includes a Disaster Response and Research Reactivation course and a Disaster Planning for the Research Enterprise course.